Good morning, and thank you, Dr. Gibbons, for kickstarting the day with a fantastic keynote. Hi, everyone. My name is Anshul Pandey. I'm the Chief Technology Officer for Stanford Children's Health, and excited to be hosting this first panel that is focused on the unique challenges with apps, wearables, and remote monitoring for children. As Dr. Wall mentioned, despite massive increases in innovation and investment in digital health, the pediatric side has not seen that substantial increase. And for talking about some of the issues around pediatric innovation in the space, we have with us a really fantastic set of experts to discuss it. And I'll start with Dr. Oliver Lami. Dr. Lami, if you could just introduce yourself and tell us a little bit more about your work.
Yeah, good morning, everyone. Thank you so much for the invitation. My name is Oliver Lami. I'm a vascular surgeon, and my main research focus is on clinically validating the sensors in smartwatches and smartphones in patients with cardiovascular disease. But also, I really focus a lot on the translational science. How do we implement many of these technologies at scale beyond just a pilot? And here at Stanford in particular, under the umbrella of BioDesign, I'm a faculty member there, teach two courses, BioDesign for Digital Health and another one called Building for Digital Health, where we leverage this open source platform we call Cardinal Kit to help bring 2 to 3 projects a year to life here in the Stanford ecosystem.
That's fantastic, Dr. Lami. And the Cardinal Kit is available for anybody to use. And it's supposed to accelerate the ability to create digital products because you provide the ingredients to make apps really, really rapidly on that. Great. Next up, we have Ryan.
Very true. Thank you.
With the Levitt Partners. Ryan?
Yeah, thanks for having me. I'm a principal at Levitt Partners. I've been there for about 5 years. My background's all in healthcare technology for a couple of decades. In the 5 years we've been at Levitt Partners, we focus on bringing together multi-sector stakeholders to try to solve these really, really difficult issues in healthcare. Kind of a unique model. And one of the ways that we do that as a result of, Governor Levitt, when he was former Secretary Levitt, he did that on a very bipartisan basis, looking for areas where we can agree in healthcare, which is actually pretty significant. One of those topics has been business to consumer data exchange. How does an individual start to aggregate their own healthcare information to an app of their choice, both clinical and claims information? And so we started a group under the leadership of Anish Chopra and David Brailer, David Blumenthal, and Governor Levitt about 5 years ago, called the Karen Alliance. And it's focused primarily on how individuals can have access to that information. And as part of that, we've done a lot of work in digital identity in the space there, and I'm excited to chat about it today.
That's fantastic. And the Karen Alliance's trust framework, as well as the code of conduct, are pretty remarkable in terms of the simplicity of those frameworks, but the complexity is really underneath it, and the thought process that has been put into to make it easier to do the right things as people are creating these applications. A great work out there. Right. Thank you very much. Up next is JP. He's the co-founder and chief architect of the Commons project. JP, take it away.
Thanks, Anshul. Hi, everyone. It's great to be here. So I am an information and computer scientist, and I do work both from an academic perspective and as a builder, basically in the space of helping people get access to their healthcare information and put it to good use. And research, my work at Weill Cornell Medicine and Cornell Tech, this has largely been in building open source tools and designing data collection methodologies for people to get access to data to use them in digital mobile clinical trials. And in industry and tech, that's meant building consumer-facing applications. Thanks to some prodding from the same Anish Chopra that Ryan mentioned, we started building something called Commonhealth a few years back, which is meant to be the Android equivalent to what Apple has done with Health Records and HealthKit on the iOS platform. And have been spending a great deal of time trying to get that out into the community in the hands of developers so that we can see lots of great and innovative digital health tools built on top of clinical information.
That is fantastic, JP. And the Common project, especially around the work that you have done with Android, is remarkable because it's the first time the Android users are actually getting something that they could natively use to actually access the record on the device. And I think you've done some really interesting work on the pediatric side as well. So we'd love to hear more about that during this session today. And last but not least, we have Denise Taylor with Privo. Denise, go ahead.
Thank you. Thank you for having me. And what a great panel to be alongside of. So I'm Denise Taylor. I'm the co-founder and CEO with Privo. It's an acronym for Privacy Vaults Online. We celebrated our 20th anniversary in February. Currently, we offer a compliance program for children, sort of all things children's privacy, primarily digital, where it touches digital in some way. We got our founding with the Children's Online Privacy Protection Act. So I have literally responded to every request for comment for 20 years from the FTC and have seen the evolution of, children's digital privacy or the lack thereof in some cases. We're a safe harbor with the Federal Trade Commission, which means that we can audit and certify apps and services that they're meeting the requirements. And we stand behind that with a trust mark, a Kids Privacy Assured by Privo. We have COPPA, GDPR Kids, and student digital privacy programs that we manage, which, as you can imagine, we see it all. We work with ad platforms and device manufacturers, and so we get a really good view. And we work with great people who want to do a good job. They raise their head above the parapet, as my chief privacy officer would say. She's a Briton, and they really try to do the right thing. And then I'll just end with early on, my company founded because I had invested in a startup that a family member had started around children and market research and product development and their ability to collaborate and bring nutty ideas and creations to life. And it tripped over the regulations. So my goal from the beginning was to arm parents with a way to sort of bank their information, verify their identity, associate their loved ones, and manage consent to be able to actually administer themselves under this regulation. So here we are 20 years later, and I think healthcare is so interesting as well. And minors' identity is very unique and challenging, and that I think we can learn a lot from the commercial world of what COPPA in the past seemed to represent to how it's now also representing commercial in healthcare and what that means for children's privacy. So I'll stop at that.
Thanks, Denise. And it's interesting, right? The kids' privacy concerns, especially with digital health, are very similar to aging parents where you might be a caregiver. There are a lot of similarities, and as our country starts to continue to age, this will become a bigger and bigger issue. And I think we can learn from both ends of the spectrum in terms of how to improve just digital access as well as consent in a better way. So Oliver, tell us more about, what are some of the considerations for pediatric apps and development of those pediatric apps? How do you think about that?
Yeah, I can get into the pediatric, but I think it's really important just to speak at a higher level, about the issue or the challenges with implementing implementing the any sort of digital health application. And honestly, in my opinion, one of the biggest challenges is just making sure that all the stakeholders, have the right incentives to offer support and kind of engage with digital health apps and implement these digital health applications. Is the health system incentivized to connect with the patients outside of their home? It turns out that digital health has the greatest adoption by institutions that are at risk for their patients, whether it's self-insured employers, integrated health systems, or those health systems that are aligned or are more in the value-based healthcare system. So to me, that's one of the biggest challenges. We've piloted, there's no dearth of amazing ideas, to be honest. I have people approaching me all the time with amazing ideas that make so much sense for the patient and for the provider. It's finding a home for that idea where, again, the incentives are aligned and there's funding and reimbursement for that sort of a project to be sustainable. That to me is one of the biggest challenges. I think, in terms of privacy and security, there are definitely challenges around that. And Denise it's going to be really interesting when we dive deeper into her work there and being, how do you become a surrogate? Do you need to be a surrogate? And she has some interesting thoughts there. And then around interoperability, there's still many, many challenges that Ryan and JP are working on. So I would say, specific, just in general, I think for me, that this idea of making sure that all the incentives are there and the incentives are aligned for all the stakeholders, to me, is one of the greatest hurdles, in the implementation of digital health applications.
That's great, Oliver. And incentives come back to haunt us in healthcare. And in the absence of alignment, we see new ideas come up and die pretty quickly. And getting those aligned the right way is always hard and tricky, just because of how regulated the industry is, and sometimes it's that much harder to get those alignments in place. I'd like to pull out Ryan and JP to talk a little bit more about some of the things that you are seeing in terms of challenges of getting data from a remote monitoring device, which is potentially shared between a parent and a child, as well as the fact that in a lot of cases, you almost have to share two data sets within a device and then transmit them appropriately to potentially an EHR or a vault or an application. How do you guys think about that as an issue, and how do we solve those problems?
Yeah, well, let's tackle problem number one, which is trying to get the data out of the systems, right? So we're still not quite on problem number one yet, but to your point, getting the data read back into the systems is going to be important too. I will say, I think it's helpful to kind of level set where we are right now, right? So in the last 2 years, every major CMS provider, ones that are billing Medicare and Medicaid, have implemented FHIR-based APIs, which means there's an ability now to send healthcare clinical data via FHIR APIs, not only in a business-to-business sense, but also to consumers through an app of their choice, right? So that's great. By July 1st, there's going to be an infrastructure where all the CMS payers who bill Medicare, Medicaid, and state Medicaid fee-for-service agencies are going to have a FHIR-based infrastructure on the payer side, which means now we can take the clinical data and we can take the payment data and be able to match that in a way that's consistent for an individual to start making informed decisions to better their health and their health care, right? Now we need the apps to actually connect to that data. We're still a ways off from doing that. We need an address book. We need a FHIR endpoint directory, for example. That won't be national. It's going to be private sector based. We need a way to simplify the exchange of the information so that we know who these apps are, that they're not nefarious. We need a process by which to make sure we can understand who the apps are, where they're coming from, who they got certified by, what best practices they're following, et cetera. And then most importantly, what we're talking about here shortly is digital identity. It's been a topic in the Caring Alliance we've had for at least 3 or 4 years now. We've talked to all the really leading experts on this topic, and most of them are outside of healthcare. We've talked to NIST, and we've talked to Denise, and we've talked to all kinds of folks related to identity and what does identity look like in the real world, including the major identity providers. We've talked to banking. We've even talked to folks around the globe. Interestingly enough, digital identity is really popular outside the US. It has not gotten as much traction here, but is starting to get more traction. And so with that aspect, I think to answer your question directly, Anshul, is that for us to really start making this data flow, and to be quite frank, it's going to be a read-only situation initially. The ability to actually write this data into systems is still going to be a ways off because we don't know the provenance yet. We don't know whether or not it's actually came from Stanford or not. And so we need to develop that infrastructure enough to make this work at scale. But but read-only is good because we can read only into an app, read only into the cloud, and that allows us to be able to massage and do things with the data to apply AI and ML to making this work at scale. But certainly digital identity is important to make that happen. And I think if we have that infrastructure in place, not only identifying adults, which we can get into here in a second about what that looks like, but then identifying peds, that's going to be also super important. But JP, what would you add to that?
Well, I think that was pretty thorough as far as the data access. And the second question about the commingling of data and sort of managing who has access to which data and how that works in practice, that's a thorny enough topic that I'm going to enjoy listening to Denise talk about that in a little while. So there I've done a double punt, but I will comment on this from the perspective of user experience and from understanding who your audience are. And this is one of the bigger challenges that I've seen, right? Are we building an application that the child is using for themselves? Are we building applications that the adults are using and administering, sort of digital therapeutics to the child in some way? Is it meant to be used by both? And even within the realm of, using these applications with children, adolescents, and so on, we have experience building a mobile intervention for healthy eating that the exact same intervention was demonstrated to be quite successful in children about ages 12 to 13. And as we moved it both up and down the age spectrum, it was demonstrated to be completely ineffective. And so the targeting is actually quite narrow depending on some of the different types of interventions, particularly if they involve social aspects as kids grow and mature.
And the social aspects change over time too for the kids. So that makes sense, but it also means that it's that much more complex to make a product that'll last multiple years or through the entire teenage experience or preteen to teenage experience for kids. That's a fascinating insight, JP. Thank you.
Before Denise jumps in, I just have one comment since we're talking about the commingling of data. Just a great example and use case, something, Ochsner Health System, which is really advanced, has implemented a lot of digital health projects and programs. They use the person's device, mobile device, as a way to authenticate who the data is coming from. So in their hypertension management program, what they do is, you can't just get a blood pressure by putting a cuff on and pushing a button on the cuff. You actually have to start the authentication process from your phone. So that it doesn't solve all the problems, but it's an interesting approach. But the question then becomes, is the child's phone registered to the child or to their parent? And, it's still very confusing, but that's a really interesting example of how someone who's implementing all this is trying to solve that issue a little bit.
That's fantastic, Oliver. So the intent is the digital identity is really the device itself.
Yeah.
For the person.
And just, when you think of children and what is in the category of personal information or sensitive information, the rules that we have to work with now that relate to digital or COPPA doesn't have really a category for sensitive information the way the GDPR does. Instead, minor data like healthcare data, like financial data is a protected class of data. And then risk is put against it to decide, just what assurance levels need to be in place for the collection, use, and sort of disclosure of any of that information. So in the kids space, it almost feels as if we've got a couple of regulations that we're all looking to that are sort of informing how we might operate, but it has all sorts of other interesting nuances, like parents know the authentication questions for a digital ID. And, teenagers have privacy too. So those apps that were mentioned earlier really have to be for all and both, perhaps. Some may be only for children, some only for adults, but I think you have to plan for any of them could end up being a portal login for a child, an adult, or and then once you're collecting the data, it doesn't matter who owns the phone. That's the YouTube sort of violation that people might be familiar with. It's, do you believe it's a child on the other side that the data is coming from? And then therefore you now trigger some of these other, you have to assume that data belongs to the child and it has special safeguards. So
that's a great point.
this adds a little
Denise.
layer of complexity.
Yeah.
That's all doable.
No, that's a great point, Denise, because if you think about families and the typical secret questions to get to the password, it is really around mother's maiden name or some other date, et cetera, which everybody in the family probably knows, and that makes it everybody has to rethink how we do those secret questions and stuff. Fantastic. So Ryan, tell us a little bit more about digital identity and some of the challenges with that you're seeing, as well as more so on the pediatric digital identity side.
Yeah, well, I'm going to cut to the chase, Anshul, and say, look, pediatric digital identity is super hard, and part of the reason it's super hard. And Denise is the smartest person in the country on this topic, so I'll throw that out there as well. And she's done the most work on this, and it's ironically been outside of healthcare. But what's interesting here is that we need to figure out adult digital identity first in healthcare, I think, and not that it's completely serial in this, but then we can move to the pediatric digital identity. So I will say. On the adult side, what we have started to look at is kind of 5 key things. One is identity. Are you who you say you are? In the physical world, this is, for example, government issued identity or any type of identity that proves you are who you say you are. 2 is authentication. Can I securely log in? That was what Denise was mentioning, and we'll talk about that in a second. 3 is what we're calling federation. So can I take one digital identity and use it across multiple systems? 4th is consent. Do I have the consent to be able to make this happen, right? Am I proactively making a choice? And then 5 is this thing called patient matching, which usually in healthcare, that's where we start, because we have this, I like to affectionately call it comparing garbage to garbage, right? Like, I don't know if this is the right information, and I don't know if this is the right information, but we're going to send this back and forth to each other and do these complex algorithms to somehow match the data, and we think it's the right person, and therefore we should send. It makes it tough because the person is not in control over their own identity information, right? The institutions are in control of that. We need to change the paradigm to say, I'm an individual, I'm going to choose, this is who I am, this is my current address, this is my current phone number. Therefore, all of the institutions should trust me because I'm the source of that information, right? So we're really changing the entire paradigm in its head. So let me run through it really quickly and show where we are as far as progress. 1, I'll start with authentication. Denise mentioned about the device being the authenticator. One of the things any computer scientist like JP or others would tell you is usernames and passwords are just gone. They're all on the dark web. Everybody has one. Most people have yours. And so there's this kind of concept of we need to get rid of them. And big tech and others have known that for a long time. So they came together and formed this alliance called the FIDO Alliance to develop an open standard by which you can use the cryptographic, you can use the biometric in your finger and the cryptographic key in your phone. The combination of those 2 factors would actually authenticate you into the system. So think of it like the user interface would be Touch ID. Touch ID unlocks the passwords, but what FIDO does, it actually becomes the username and password. Doesn't store the biometric, doesn't store anything else, but it's super secure because it doesn't matter who I am. It just matters that I have this phone. I'm, registered and connected with my biometric. That becomes really interesting. So we've kind of really solved that. It's on every device, Android 7 or higher out there. It's on iOS now as of last summer. Microsoft has it. So we've kind of solved that as an industry, and you're going to see that more and more, and you're already seeing it where usernames and passwords are somewhat going away. The identity piece is a little bit more difficult. We have a standard out there called the NIST 863-3. People are implementing that now to what's called an identity assurance level 2 or higher. There are a lot of good companies out there that are doing identity proofing for individuals, which is good. We're encouraging folks to get their identities out of their portals and moving it to identity providers, and therefore it can become a little bit more mobile. 3 is on federation. We're doing a lot of work in Karen on federation. We're actually creating an entire identity federation framework. that is going to allow a payer to send data to a provider and that provider to send it to a patient. And the entire way through that could be consumer mediated, where the consumer is directing that and the consumer only has to prove their identity once throughout that process. That's a really exciting frame. Consent, we've done a lot of work on individual consent. We think we're going to move from a HIP authorization world to a actual individual consent-based data sharing framework where the individual is going to start to be in control of their data. They don't realize when they sign that clipboard and that HIP authorization where in the world their data goes, but it goes everywhere, and that's going to start to change over time, and that'll allow this whole patient matching thing to somewhat go away over time. You're going to see, I think, patient matching somewhat go away because if we can truly know who you are, we can securely log you in, we can federate your identity, and we have your consent, then it starts to kind of peel that away. Now, we've still got to solve the pediatric question, and we're going to lean on folks like Denise and others to help us solve that. But we at least have these building blocks to get us started.
Thanks, Ryan. Denise, can you tell us more about the consent portion and COPPA and some of the challenges between those two? Because
Sure.
It seems like the regulation might be in a need for an update to the modern day. And I know you've been at the center of thinking about it.
I would say there's also opportunities here. I see COPPA as a big use case for identity. We just talked about how do you provision the account? How can the account be federated so that it's an easier use, but still secure and resilient for the individual who carries it? How do we verify identity that you are who you say you are, and then take a next step and verify that you and your child are actually associated, or whether you're a parent or guardian or what your position is, and then what rights come along with that. Lots of other rights issues to think about because children themselves, as I mentioned earlier, have their own privacy rights. Do they have to consent to a parent to receive certain data within their electronic healthcare record? And then you also have to be considerate of, I don't know that we want everybody eliminating and deleting their medical records. But it's a theme in commercial, you need to let me delete that data you've got on me, all that data you've tracked and compiled and learned about me. But boy, like I would worry about a parent just blanket saying delete to a federation that then expects deletion across the entire federation. Some would say, well, ease of use. No, I think you have to put the controls at the service, the feature, what is it enabling? You might string some of that together to be easier to opt in and out of, but it still has to get right down to what are the fourth parties that my data just got shared with that particular service? No, I'm going to turn that service off, that app off, without getting in trouble with healthcare, and my records have been deleted by me accidentally. And all of a sudden we thought there was a record of my, glucose, and all of a sudden it's not there anymore. So.
And so the challenge, Denise, that you're talking about really is how do I differentiate between my primary care provider having my kid's data versus another third party? And when I request a delete, how does it not affect my primary care provider, but still affects the third party that I don't really want to have my data in the first place?
Yeah, and in the world of the average Joe, they don't know what a pediatric app is versus a education app, because all you have to say in the stores, it seems, is this is good for your kid, it's educational. This is good for your kid, it's health and wellness related. So there's in the medical industry, you all are used to protecting data. Let's forget how we're going to do it digitally. You got to do it the good old-fashioned way first before you could ever start sharing. But you've got, when you have innovation and companies emerging with apps, and it's easy to push things out off the engines that are available, I think those platforms and engines are going to have to get more wise on trust and safety and start inquiring, are there minors associated with the use of those apps that are being developed, and then make sure that they've got the smarts to do it to do it in a compliant way, which is not as easy as it would be otherwise. It does mean a little friction along the way.
Oh, that totally makes sense. Go ahead.
Sorry, I have a question for Denise and Ryan, but starting with Denise, what is your pie in the sky, or is there an implementation that you really admire? Is there a good example of someone, it can be even in the consumer world, that has done it really, really well, that could be used as a model? Does that exist?
Yeah, so we'd like to say that we've done some of that. I mean, we offer an identity and consent service that's completely API driven. So we have some very, very large customers and little startups that use, our APIs perhaps for authentication, verification, and consent, or one or the other. But what I can tell you is that there are a lot better use cases to come than there are to model off of. I believe that industry has tried so desperately hard to turn away children at the door requesting use of a service that you just don't see the reality of what's happening, which is in the commercial space, every kid is 13 and over. They're just at the gate, so until we have smart age gates, intelligence conducted at the gate, at the door, to the features and functionality that's privacy enhanced, but is also maybe respectful of all the parties, whether that be the doctor, the parent, the child. We're going to continue to have, at least on the commercial side of the world, a lot of fraud in that children will not actually, they won't actually be the age they should be using the apps and services. So what's going to happen when that starts to inform other medical, but the kid was 8, they lied and said they were 13 to get to the digital app that has the prize that's on Facebook, where they just fibbed about their Facebook account. Once they get these federated IDs, they just use those to log in. So relying on existing federations where children notoriously fib about their age is problematic in the minor space. So I think I just put a bunch of salt and pepper into a storyline. I'm happy to take specific questions. And so thank you.
That's great. JP, can you tell us a bit about your experience building the Apple Healthcare Kit equivalent with the Commons project with Google, and especially some of the lessons that came out of the pediatric portion of that?
Yeah, so I mean, this is it's a really interesting time for this work. Ryan detailed some of the great regulatory advances that we've had, and the community that came together to build a lot of the standards and practices that that led to that regulation being as effective as it is. Speaking specifically to 21st century cures and the information blocking rule portion of that, which is what most people think about. These are regulations that give people the right to choose which digital application or service they want to use their data in. And this is a big deal because not just because folks like us get to build apps like we're building, but we heard from Dr. Gibbons earlier about this preponderance of health apps, and that's fantastic. But I've long been one to argue that the real digital health apps, the ones that we all think about when we talk about this future of digital medicine, there's a very small minority of this preponderance of apps that are those. And a lot of the reasons that those don't exist yet are because of challenges to data access, and we're finally starting to get there. So, the challenges facing app developers are getting access to information about a person's context, about the symptoms they're experiencing, about their underlying conditions, right? And how can we make it easier for developers to access this? The first digital health app that I built was on a Palm 3. So if you know what that is, that dates since the time that I've been working in digital health. And in those days, we had to ask people everything. There was no means to collect any other kind of information. Over the last several years, we've been able to get access to wearables data, which has given us great information about, sort of context and increasingly patient-generated data, things along those lines. And now with, the regulatory tailwinds that we finally have access to clinical data. But it's still not easy, as Ryan described. And so, what we've really been trying to do, and what Apple really broke ground on the Apple devices, is putting those data in, sort of building that app that gives people the ability to access those data, and then making super easy SDKs and APIs for developers to build on top of. When technical innovation happens, when there's really hard challenges to solve, but innovations for people and consumer applications and health applications happen when it's easy to build and test and to get the evidence that we need. In the pediatric domain, it's definitely not in the easy camp yet. All of the challenges that we've heard around identity, access is still remains to be a problem. Those persist, but I think that we're getting to the point now with the combination of these regulations and the driver that we've heard COVID has been towards virtual and digital medicine. I think we're finally at the tipping point where the promises that I've been making for 20 years about digital health might turn into truth more than fib. So pretty excited to see where things are headed.
Thanks, JP, and thanks for the panel. This has been fantastic, and it's great to be in an age where we can say that the incentives are actually aligning, the regulations are actually aligning towards opening up that data and making it more accessible, and then some of the deeper technical challenges are being handled so that the next level applications, which as JP eloquently pointed out, the easier we make it for somebody with an idea to be able to create the app will be super good, and will just accelerate and help all of us as well as our patients in terms of getting the right care that they need at the right time. For quick takes, vaccine passports have been hot. What are your thoughts? 30 seconds each. Let's start with Denise.
I thought I heard the vaccines were 16 and over. So as the minor representative, I bow out.
I think it's a matter of time before we get to the 12 to 15. Pfizer's pretty close to getting their approvals. Ryan?
Yeah, look, we're JP and I are working on this pretty hard too. The deal is that this is the use cases are going to be international travel and cruising, and potentially sports situations where they want to fill sports stadiums or concerts. Those are probably going to be the big use cases. Federal government said we're not going to require any proof of vaccination, but as we talked about just before we came on the air, regardless of whether anyone decides to download their what they call W3C's verifiable credential to prove they've been vaccinated through what's called the Smart Health Card standard, the industry is actually collaborating. There's over 300 collaborators right now getting together and actually creating new technology that cryptographically signs healthcare data, testing and vaccine information. No one's getting paid, and there's no regulation that has been passed. So it is absolutely phenomenal to see people collaborating in such a great way without those two things driving them. And it's been remarkable to see it just in the last 6 to 7 months.
That's fantastic, JP.
Yeah, so I'll just sort of echo what Ryan said, and the work that we're doing on this, it's going to be called the Smart Health Cards framework. But the idea is less about giving you a vaccine pass that you get to sort of run around and show everybody, and giving you access to your signed clinical health information. So it's a piece of your clinical record that is signed and verifiable, which makes it portable. That means you don't need to log into your portal every time you want to access it. It can live on your phone, in your email, on a piece of paper. And we think that, as Ryan mentioned, this has applicability long beyond COVID, and pretty excited to be able to work on this.
Oliver?
Look, I'm going to echo again. I agree. I feel like COVID has done so much. People say that we've accomplished in, a year or 6 months what we thought wouldn't happen for 5 years. And to see that also translating to this technology, I think it's really very positive. And as long as people, have the choice, and it looks like that's how it'll play out, I'm really excited about the technology and the fact that it's really we've gone into hyperdrive to make it available. So it's really exciting.
And I think we're seeing it the same way. In fact, Natalie Pagler and I were discussing it, and her big thing was it shouldn't be just COVID related. It should be all vaccinations. And that's what kids need all the time for everything from going to schools to summer camps to you name it. And to have the technology to back it up, to say, we can verify and validate that this is accurate. and tied to this particular persona or digital identity would be huge in terms of easing the work that our pediatricians do all the time in terms of providing that one pager with I have certified that all of these vaccines have been provided to the kids.
Well, Anshul, I want to thank you and the panelists. It's been a really great session. We have two quick questions from the audience, if people are willing to hang on for one more minute. So the first is directed to Denise, and the question is, have you used blockchain technology for consent? And that's coming from a colleague in Italy who's signed in late at night.
We have not at Privo, but it is absolutely a player in looking at across the architectures that can be used in this space. And I think when you separate out, as he did, the consent component of that, and you find ways to link to identity that can be separated from that, then you know, somewhere in the chain, you can still get a breakdown. So there's just a lot to be thought about. But yeah, I think blockchain absolutely has a place at the table.
Excellent. And then the last question, I think this one's going to be squarely in JP's camp. Someone, talked about how medicine really has a low tolerance for risk given privacy issues. What's sort of your top 1, 2, 3 regulatory things that you'd like to see in the future to help enable the vision that we've shared in this panel?
Oh, wow, that's a good one. I didn't realize I get to start pitching my regulatory wishes and dreams here. I imagine Ryan has a couple as well. I mean, realistically, the ability for people to get access to all of their health information is still one, right? We've talked about the regulations which let us get access to a lot more of our information than we could before, but it's not all of it, and a lot of it is coming in formats that are extremely hard to deal with, and they're coming from all over the healthcare ecosystem. So as an app maker, there's still going to be work to do. One of the things that remains a challenge is around consent and the handling of data once it gets out of HIPAA. We in the United States don't have comprehensive privacy laws, as we all know. And so it makes for a lot of confusion and a hodgepodge. One of the things I always talk about is there's this real false dichotomy that currently exists between a belief that either all data need to be locked down and very paternalistically protected on one end of the spectrum, and this dark web wild west on the other. And I think we can get to somewhere in the middle, and it's going to take work from both private sector and a little bit of regulation, but I think we can get there.
Fantastic. Well, again, thank you to everyone who participated in the panel. We are going to transition to a few more videos for the next 7 minutes, and we'll be back live with our next panel at 10:30. Thanks again, everyone.